Hi there, my name is Dr. Shoshany. I'm a chiropractor and I've been practicing in Manhattan for over 20 years. And today I want to talk about one of the most difficult to treat conditions that we see in our office. Specifically, I'm going to talk about chronic sciatica. That's usually in older patients with degenerative conditions. So I've been practicing for over 20 years, and one of the most difficult to treat conditions are people that have sciatica that are a little bit older, that have degenerative disc disease, they have loss of disc height, and they just had this problem for years. So how do we help them? How do they get better on their own without drugs and without surgery? So when a patient has sciatica and we treat them, they usually require a longer course of treatment. It's not the overnight success that we usually see with patients that have headaches or simple back sprains, strains. It's definitely more of a commitment. The sciatic nerve is the largest nerve in your body. Behind me there's a chart here, and that's the nerve. It's about the thickness of your thumb, and it starts from the lower back, and branches of the nerve go all the way down to your leg. When you have sciatica, you could have a burning, a numbness, a tingling in your leg. It's a very uncomfortable situation. It could cause weakness. It could cause, if it gets severe enough, it could cause drop foot, where you actually lose control of the bottom of your foot. Not a very pleasant situation. So practicing for over 20 years, I've had patients come in with all ways they've hurt their back. But one of the most common is they bent over the wrong way to pick up a pen, or they were putting an air conditioner in a window, taking an air conditioner out, taking luggage out from an overhead, any of those combinations. And I always stress it's not that one movement, but a cumulative effect of all the other movements and the underlying pathology that contributed to this one flare-up. In our practice, we focus on a non-drug, non-surgical solution. We're looking to have the patient 50% better within 5 weeks. Better meaning symptomatically. Are they able to walk further? Are they having less pain? If we're going down that right track, we continue treatment. If not, we'll refer out. So patients need to understand that when they have had the symptom for years, they don't get better overnight. It is a little bit of a long haul of a treatment. And when we treat them, we integrate our approach. So it's not just chiropractic care. It's chiropractic care along with physical therapy, along with modalities like spinal decompression and deep laser therapy and muscle strengthening. In the past 20 years of helping patients with this very difficult condition, I can only remember a handful of times where I had to refer the patient out for a surgical consultation. People do get better, but there's always going to be a couple people that are going to require some surgical intervention or some medical intervention to get out of pain. So the word integrated, you hear it a lot now, but what is integrated? Integrated is taking multiple disciplines, putting them together and working hand in hand. So it's not just a chiropractic adjustment. It's a chiropractic adjustment along with a physical therapy that assesses how long muscles are, what muscles are tight, what muscles need to be stretched, what muscles need to be lengthened, strengthened and toned, along with at-home things that you could do in between visits. So when you combine the chiropractic care, the modalities like spinal decompression, which focus exclusively on the disc and taking pressure off the nerve, combined with physical therapy to strengthen, we have excellent outcomes.